everyone. I'm Dr. Renee. Thank you for joining. Today's podcast is on the future of U.S. healthcare. Do we see an integration of holistic healthcare treatments alongside conventional care in our future U.S. healthcare? And what are some of the obstacles that hinder the acceptance of integrative medicine with standard care delivery? We know that the biggest driver of healthcare expenditure is chronic disease, whether it is diabetes or cardiovascular disease, cancer, obesity, and mental health. 90% of the 4.9 trillion US dollars of health expenditure go in chronic diseases management. And this is coming from Centers for Disease Control and Prevention. In the Commonwealth Report Fund, we see that US consistently has been ranking low in health outcomes in chronic disease management, despite the fact that we spend so much money. Diabetes, $419 billion annually on direct and indirect medical costs and loss of productivity. Cardiovascular disease is number one killer in the United States. Cancer is number two. Yet the picture, it doesn't seem to be right after spending so much money. But there's a silver lining in the crowd. There is a growing wellness market, which is valued at $2 trillion in the United States, the largest in the world. And this is coming from the Global Wellness Institute. Americans spend over $6,000 annually on out-of-pocket expenses for the provider visits or for their self-care protocols and nutraceuticals and functional foods. So join me today on this podcast. We have a very distinguished panel of doctors who are going to share their views and their insights on integrative medicine and what are some of the challenges and the pros and cons of creating these new pathways of health in the United States. Joining me is Dr. Tim Fior. He has been practicing family medicine and homeopathy in the Chicagoland area for almost 3 decades now. He's the founding partner in the Center for Integral Health and is the current treasurer for American Board of Homeopathic Medicine. Dr. Fior is the author of textbook Essentials of Homeopathic Medicine and is a contributor to the book Meditation as Medication for the Soul. Thank you, Dr. Tim.
Thank you.
Dr. Avinash Jadhav is a board-certified orthopedic surgeon in Brooksville, Florida, and he specializes in robotic hip and knee replacements, trauma, and pediatric orthopedics with extensive experience in treating a wide range of orthopedic conditions. From Central Florida also, we have Dr. Parna Bapat. She's a distinguished Ayurvedic medicine practitioner, educator, and entrepreneur, having worked in the United States for over 27 years, both in New York and Florida. I've known her for a very long time. She received her bachelor's in Ayurvedic medicine surgery, BA-MS, from Pune University in India. And currently, she's the president of the Ayurvedic Association in Florida and also the International Council for Ayurvedic Accreditation. Eddie Stern, thank you so very, very much. He's at the airport flying to Delhi, and I don't know how you made it, but I'm so very grateful to you. Eddie, I've known from New York for many, many years. He's a yoga teacher, author, creator, lecturer from New York City. His practical approach to teaching and practicing yoga is a mix of science, spirituality, philosophy, and social service. Thank you all for joining me today. Let's dive deep and talk about some of the challenges that we have over here. I'm going to start with Dr. Tim.
Yeah, so, I've been practicing medicine now for 38 years. And I started off, trained as a family physician, which I thought that's a good model, family practice. But when you get into academic medicine, family practice is devalued. Specialized medicine is valued because it usually brings income to the hospitals and into the system. So luckily I met a colleague who was practicing homeopathy and I started using that. And now I'm to a point where that's the main thing that I do. I find that patients really want some type of a, like you say, an integrated approach where their specialists do the best that they can do and talk with them, tell them about the pluses and minuses of the treatments that are available. And then they integrate whatever other modalities make sense to them. For some people, it'll be yoga. For some people, it'll be Ayurveda. For some people, it'll be botanicals. For some people, it'll be naturopathic. For some people, it'll be homeopathic. And I find that the patients who do that, those are often the ones who get some of the best outcomes. And part of it is cultural. However, you were brought up, whatever your family has used in the past, by using those other modalities in addition to conventional, the best of conventional, you get the best outcome. So I've always approached it like you want the best of both worlds. And I'm not affiliated anymore with any hospital. So when I refer people, when someone has a bad case of cancer or this or that, I find the best place around to send them and send them to that doctor or that center. I don't, just refer to my friends or whatever. It's like whoever's has most expertise in that area, that's who I want to send the person to. And when I get good feedback from that area, then I know, okay, keep sending there. So that's I think, best of both worlds is really what patients want. Unfortunately, in medicine in this country, it's kind of a historical artifact that, in the 1800s, early 1900s, homeopathy, botanical medicine, allopathic medicine, all were fighting for. And then Rockefeller, because he was an oil man, he liked homeopathy, but he gave virtually all his money to allopathic medicine. And so ever since then, allopathic medicine has funded so many big hospitals and medical centers and all that. And it's kind of skewed medicine in this country toward just conventional medicine. And one of the reasons he did it is because he was an oil man and conventional doctors were developing drugs based on petroleum products. So it was in his best interest to fund that. So I think India does it very well. They support Ayush. I think our country, and now with our current administration, it's interesting. Things are shifting a little bit away from just pharmaceutical medicine to maybe supporting other things. And, in the United States, you mentioned all those problems that we have where we spend twice as much as any other country, close to $5 trillion a year, and yet we have the worst health outcomes, and yet we take the most allopathic medicines of almost any country. What's wrong with this picture? We're missing the whole lifestyle and looking at the whole picture. We're just looking at it in a very narrow, reductionistic way. We need to look at the whole person and look at all these other factors and deal with lifestyle and use whatever other approaches make sense.
Yeah, the picture is cute. And you talk about India does promote many other holistic healthcare modalities of treatment, including yoga, Ayurveda, Unani, naturopathy,
Homeopathy.
homeopathy. So there's a lot, and many other countries, European countries do that, Sweden, Switzerland, Germany, France, Japan, Israel. We're talking of so many countries, Thailand, China, all of them. They are integrating integrative medicine in standard conventional care. Dr. Avinash, could you add on to what Dr. Tim mentioned just now?
Tim said it very well that in this country, definitely conventional medicine or allopathic medicine or modern medicine, whatever you call it, really has got the most importance and takes the lion's share in treating the patients. And integrative medicine should be what should be practiced and should be made available to the patients, because modern medicine doesn't have answers to everything. It has answers to a lot of things, probably more things than any other branch of the medicine, but still it doesn't have answers to everything. No single branch of medicine is complete. So integrative medicine is the answer, and because it's so much biased towards modern medicine in this country, in the United States, we need to focus on other branches, Ayurveda, homeopathy, yoga, chiropractic, acupuncture, Chinese medicine, all those things, because each one has some special things to offer. Unfortunately, the physicians are not trained in all the branches. It'll be nice if in the medical school we have a little bit of glimpse of other branches, Ayurveda, homeopathy, Chinese medicine, so that we would at least know what are the best diseases for which we can refer our patients to these other branches. But that's not there. Hopefully that day would someday come. Let's be hopeful.
So you mentioned bias, that's one thing. And second was So we have a negative attitude and skepticism, and that hinders the acceptance of integrative medicine in the United States. Second, you also mentioned that in the curriculum, when you're going for medicine, they don't teach you, maybe make a few hours, just not even a full semester. So conventional care doesn't have that curriculum that should be put out about holistic healthcare modalities of treatment, and then have a bigger picture like Dr. Tim mentioned. And I want to go to Eddie and then Vedya Parnabapat on this. What do you think? Is it the skepticism about holistic healthcare treatments and the negative attitude and the bias that's hindering, besides other, of course, obstacles that we have in having this accepted in conventional care?
Well, I can only attempt to answer from a yoga perspective. And so there are two things. One, yoga in regards to postures and breathing, relaxation, and meditation is an inexact science when it comes to pathologies. So yoga is certainly a multimodality practice because you have to do all these different things. You have to do diet, right amount of sleep, the right type of exercise for you, the right type of relaxation, the right type of meditation, et cetera, et cetera. And so in regards to establishing things like protocols or things like, specific treatment plans, it is more or less an exact science. And one of the reasons for that is because right now, and for the past maybe 100 years or so, yoga is being used for something that it wasn't made for. And yoga was made for liberation and for spiritual realization. It was made for the journey to know who you truly are, to understand the nature of yourself, the nature of consciousness, etc. This is what the yoga texts are teaching. And now what's happening since around 1927 or so, or the early 1920s in India, with Swami Kovalyananda, who started doing experiments with yoga and modern medicine, yoga started being applied to pathologies that are often seen in the world. So what we're doing is we're taking something that wasn't really designed to treat disease, and we're trying to help treat diseases with it. So there's going to be some problems with that. There's going to be some pluses, of course, and there's going to be some benefits. But what I would basically say is, from my perspective, as someone who works with a lot of people who are sick and who really loves working with doctors, that what I try to do is I try to support the overall mission of whatever the doctor is trying to accomplish with the patient. I'll find out what can I do to support the healing process, to what can I do to support the surgery this person might be going through, the healing journey, etc., and then work in totally that capacity as a support person for someone's healing journey. And because yoga is so generic, and something like relaxation isn't going to target like a specific organ, but is going to basically have like all downstream effects throughout your entire physiology, you can't really determine, this, that, or the other is going to happen specifically from doing a particular relaxation or particular posture. So the best thing from my point of view is help people relax, help people stay calm, help people stay present, help them be a little happier, and that's going to help their healing journey. So that's what I would offer here from JFK.
And we know that conventional medicine is using yoga meditation as an adjunct therapy. And because there's so much of stress, there's so much of mental health issues, meditation calms you down, brings you, centers you, recalibrates you, rejuvenates you. So it is accepted as an adjunct therapy, and we have clinical studies on that. And Dr. Tim, we have that book, Meditations, Medication for the Soul. And these are doctors, conventional medicine doctors, who have shown that in their experiences as clinical studies, they have seen better health outcomes through meditation.
I'd like to interject with just one more point on that, and that is that I have a science degree, and I've published on different things ranging from heart disease to improved grade point average using similar types of protocols. And what my hypothesis is that our nervous system and our cellular body is highly, highly intelligent. And if you make one correction, the system begins to auto-correct and know what needs to be supported. If you support homeostasis, homeostasis is going to support the thing that needs to be fixed. So you can give someone the exact, like a relaxation or meditation practice who is having trouble sleeping, and they'll start sleeping better. And then you can also give that same exact thing to someone who is having trouble focusing, and they'll focus better. So why is that happening? It's not because of the magic necessarily that you've given a particular prescription of a meditation. It's because our system is highly intelligent. And when you allow it to restore balance and support it in restoring balance, it knows what needs to be corrected.
Absolutely. Vedaparna, I want to go to you. You're an Ayurvedic medicine professional. Ayurveda at this point in the United States is unregulated, unlicensed, and so the scope of practice, even in freedom states in the country, and still the scope of practice is very limited. You can't say you're diagnosing, you're curing, you're treating. You can't say they're patients, they're clients, they're consumers. So this all new terminology that has been used for Ayurveda until it's licensed, and we have established protocols. So how do we go through these complexities, especially there's a lack of insurance and not too many robust clinical studies on Ayurvedic herbal formulations, even though we have great anecdotal evidence, because I'm also an Ayurveda wellness coach, so I understand that. But yet, it's a far cry. How do we get this as an established modality of treatment in the United States? What's your take on that?
Yes, so thank you very much for adding me to this wonderful group and to share my thoughts and vision about Ayurveda. As Eddie mentioned, there's a lot of stress that people face through their medical challenges, through their diagnosis, and through their treatment protocol. So, one of the things that I have through my practice observed that a lot of patients, when they come for a Ayurveda consultation, they spend a lot of time with a Ayurveda practitioner, with Ayurveda doctor. We give them almost an hour to hour and a half in a full supportive, listening mode. We try to analyze them through their lifestyle, food choices, other choices in life, and really understand them from a very holistic approach. So that gives them like a good, we kind of have that kind of a respect and a bond that is developed right in the initial part of evaluation and consultation. And that is why I think the results that we get are very phenomenal, even if we are restrained from diagnosing or saying any of the medical terminology. Whatever Ayurvedic philosophy and principles that we use about understanding the imbalances, understanding the mind, body, soul connection, to the holistic approach about the life and the disease pathologies and all the different aspects of why somebody is sick, or how they can heal with simple changes in their outlook towards life and making small changes in their daily routine. So all that really adds up, and as Renee mentioned, proof is in the pudding. We do get asked for clinical trials, like, do you have proof about this and that? But a lot of our clients over a period of 40 years now, that in the US, Ayurveda is gaining popularity, gaining stability, gaining some amount of standardization that we are trying to establish. So it's a long way to go, but I think the United States is definitely ready for it. The whole world is ready for it. And with the support of Ministry of Ayush, which will incorporate all of the mentioned alternative healing modalities of Ayurveda, Yoga, Unani, Homeopathy, and Siddha medicine, and of course, naturopathy. I think there will be a great future for an integrated approach towards any kind of healing that we really want to help the society and help the younger generation to understand about their physical, emotional, psychological imbalances that we see so many people suffering in the society.
Yeah, because we're bringing back homeostasis, bringing back the balance being in tune with your circadian rhythm. That's what Ayurveda promotes, and that's what we're talking about.
Right.
But do you think the logistical challenges, the difficulties in setting up proper billing and revenue structures, that is a major obstacle? And I want to talk to Dr. Avinash and Dr. Tim.
Well, it is an issue. Obviously, practitioners who are unlicensed are not going to get insurance billing. I mean, in our office, we mainly are a cash fee-for-service business, and many other homeopaths do it the same way. But some do accept insurance, and we do submit claims to Medicare, and patients get reimbursed through Medicare because I am a licensed physician. So that's where the license, if you have a licensed practitioner, they can get reimbursement oftentimes. But it just depends on their practice setting, whether they're allowed to do, integrative practice. I liked what Aparna said. We need to spend more time with patients. I mean, unfortunately, insurance only pays you for spending a little time. And how can you solve a person with complex problems? All I see is people with complex problems, multiple medications. How can you solve that in a 15-minute visit? You can't. You need to spend an hour, 2 hours, 3 hours with someone. And the insurance industry doesn't recognize that. So it's part of it's part of the problem that it doesn't allow adequate time. They're not going to reimburse for adequate time for alternative or complementary practitioners or integrative practitioners. So that's why a lot of integrative practitioners choose not to be in that system, to be outside of the system. So, but if you're licensed, you can be, and you can bill insurance, and I know practitioners who do.
Are you saying you can bill for Ayurvedic or homeopathic consultations to the insurance companies?
It's an E&M code, evaluation and management code. Yeah, exactly.
But it's the same ENM code that you'll use for conventional medicine or the allopathic medicine, right?
And then ICD-10 codes. Yeah, that's what Medicare looks at. So, and we're giving a medicine, which is homeopathic medicines are recognized by the FDA. They're regulated as drugs. Now, luckily, they're safe, so most of them are sold over the counter. A few, like Digitalis, you can't get over the counter. You need a prescription for. A few others too. But yeah, it's similar that way to a conventional medical visit. I really like what Eddie said too, is that, a lot of these modalities, they're just resetting the nervous system. They're enhancing the immune system, and that's going to help everything. In the book, Meditation is Medication, if you meditate, if you get relaxed and you tone down your sympathetic and increase your parasympathetic nervous system and slow down your brain waves, a lot of things are going to get better. And, things are changing in medicine. I don't know if any of you are aware, there's a new medical school. The newest medical school is in Arkansas. It's funded by Alice Walton, the Walmart family. She's like supposedly the richest woman in the world. It's called AWSOM, Alice Walton School of Medicine. And she was sick and she couldn't get well. She was in a bad accident, and conventional medicine can only get her so far. So she used a lot of these other practices. And so she founded a medical school, and she wanted it to be based on lifestyle medicine. And now the problem with medical schools, and I teach medical students, so I see they all end up with $200, $300, $400, $500, $600,000 in debt. So they have to become a super subspecialist they're paying for their tuition. They're getting free tuition. So they don't end up with a burden. They can go into more primary care. And so the model is shifting. It's interesting. One of the world's richest people is actually giving money. And I think that's what it will take. We can talk all we want, but until the money's there, things won't change.
So there is a paradigm shift because people want it. They want those better health outcomes, more non-invasive medicines, and there's that better rapport with your provider. You do practice your conventional medicine and homeopathy. You have that connection. We talk about the 3 A's: availability, accessibility, affordability, and ability. Accessibility and that connection between patient and the provider is so very important. You're now looking at the patient as an organic whole. Many times what happens with the doctor sitting behind the desk and the computer, and by the time you're talking about what is the problem, the visit is over. The patient has really not interacted that much with the doctor. Everything is now AI generated. There's not really that communication that the patient wants. And that is what is missing at this time to make this picture correct. So what would you say is your vision for integrative medicine? We know the challenges, we know the benefits. How do we create this new pathway for better health? How do you see that vision translated into reality? Eddie, you want to go first?
Well, I think to Tim's point about money, this is crucial. There is in New York City the Tandon School of Engineering, which is part of NYU. Recently, well, it wasn't recently, actually, it's almost 10 years ago now, that I was asked to put together a yoga and physiology course for them that became part of their pre-med program, and I think all the nursing students were required to take it. And now that course is free on Coursera, and it basically looks at all the different physiological systems and what is some of the research which has been done on those physiological systems in different modalities around relaxation, postures, breathing, etc. And so to date, that course has been taken by about 65,000 people. So this is about 65,000 people who have been exposed to ideas of movement and breathing in association with hard scientific facts. So this is something that we really enjoy doing, and we did it with the cardiology department of Tandon School of Engineering, along with cellular biologists there. So that was cool. And I think one of the things that happens is the more doctors and nurses and researchers and people in healthcare try different yoga or meditation practices and see the benefits, the more they're going to want their patients to do them. But the hard thing is getting patients to actually do that stuff. So I think there needs to be a way that these practices become really enticing and really palatable to the end user, because if the end user is not able to do these things, then it doesn't matter how much money and how much education we throw at it if people can't do it. So accessibility, ease, enjoyment, understanding that this is going to be something fun and good for you, maybe something fun and good for your family, not just something that's going to make you feel better, but it's going to have some other types of outcomes as well. So I'd say those were just a couple of quick things. And again, it's been 40 years that I've been teaching yoga, and for the past 20 years working with a lot of people who are not well at all. And with a lot of families who say, hey, I have people in my family who are really not well. What can I do for them? It's really hard to get people to change their lifestyle. So the smallest types of things, 2 minutes of slow breathing, 1 minute of raising an arm over the head and then another arm over the head. Eat a carrot, just like tiny, tiny, tiny little things, and make it fun and make it user friendly. Otherwise, it's just people aren't going to be doing it. Anyway, doctors, all four of you doctors, it is an honor to be here with you. So thank you so much for allowing me to share some of my thoughts. And I'm sorry I have to get on a plane. And I'll see you again next time.
Thank you, Eddie, so very much. It's amazing you found a quiet spot in the busy JFK airport. You have a great flight to India. We'll connect when you're back again in New York. Thank you so much, Eddie. Thank you.
Safe flight, Eddie.
Yeah, thank you.
Have a safe flight, yes.
Yeah, safe flight.
So let me just add something to what Eddie said. He said that it's very hard to get to people to do these things. And it is hard because these things are hard to do anyway, unless you've been doing it since your childhood. For that, we need a cultural shift, for change in how you bring up the whole population. It's much easier to just pop a pill, rather than sitting there and try to meditate or do yoga, put yourself in some twisted postures. I'd rather take ibuprofen or Motrin and hopefully my pain or whatever problem I had would go away. So that's the culture in America. It's a fast society. Nobody has time to do the meditation. Nobody has time to do the yoga postures. So it'll only change if you begin it right at the roots. In fact, India is a society where this has been practiced for more than 5,000 years. But still, in the last 50 years or so, it is so fast shifted towards the modern medicine because of the ease of modern medicine, because of the quickness of modern medicine. I have a brother-in-law. He says when he's got some simple thing like sinusitis or something, and his wife is Ayurveda doctor, and she tells him to do gives him some Ayurvedic medication, ask him to do some pranayama and things like that. And he says it doesn't work immediately, and I'd rather just take some pills and go to work because I have to go to work. I don't have time to spend in this. So that is a problem, and I think the problem can only there's no easy solution for that. And the solution, which is a difficult solution, is very, very difficult because we have to change people's habits from their childhood.
We understand that we're a popping pill culture and we just say, hey, doc, just give me a pill and it's a magic wand, I'm going to get better. But now there's a growing wellness market that I mentioned earlier in the podcast. And people are realizing that yoga and meditation and holistic healthcare modalities of treatment can really make you feel good. They're non-invasive, I've said many, many times before. And even now we have the National Center for Complementary and Integrative Health. They are joined from NIH, it's a branch. So America is going in that direction. It may take a little bit longer time because of the obstacles with whether it's lack of robust clinical studies, the contraindication of taking herbal formulas with regular medication. So all this and billing and revenue structures, all this does tie up. But I think we're going in the direction now, as I've said, 30 billion US dollars are spent by Americans annually on wellness, whether it's functional foods or nutraceuticals, or whether it is provider visits or self-care protocols. So we are going in that direction. It's going to take a little longer because we need cross-disciplinary education and interdisciplinary education as well. So there's a lot going on to create those pathways. Dr. Tim, what are your final thoughts on this?
Well, I kind of agree with everything that's been said. I think there's a need for education of patients, and patients have to educate their practitioners. And the practitioners, Eddie was right. It's hard to do some of these things. But what I find is when I tell the patient, look, you're kind of stressed out. You got a lot of things going on. You need to meditate. And then I tell them, look, but if I meditate, you can meditate. And I switch people with heart disease, people with cancer, people who I think would benefit from more whole food, plant-based diet or vegetarian diet. I say, look, you need to do this. And they look at me like, well, I'm like, but I do it. So I think part of it on the practitioner part, you have to live what you're telling your patients to do. I can remember in the day as I was a resident, there would be a cardiologist, he'd be smoking a cigarette, he'd put it out, he's smelling a cigarette, he'd go into the room of a patient with a heart attack and say, you need to quit smoking. And the patient's like, yeah, sure, right. You smell of smoke. So, you got to walk the walk yourself before you can tell patients to do it. And then I think things need to change at a governmental level. There needs to be support for these sort of things. And I think that shift is happening. I think India is, from my perspective, I'm not an expert on it, but it seems like they figured it out. In the US, it's like Winston Churchill said, you can always count on the Americans to do the right thing after they've tried everything else. I think that's kind of where we are in this situation.
Yeah. When they have the wake-up call, that's when things change.
Yeah, when you hit the brick wall.
Yes, absolutely. Parna, you want to give your final thoughts?
Yeah, so that's exactly when we get our patients. So I have a very successful practice for many years in this country, and it's very challenging because when we get a client to see for a Ayurveda consultation, it's like somebody who has tried everything and nothing has worked. A lot of side effects. There's like a whole file of all kinds of problems and the side effects of the medications and so many secondary, tertiary complications and things that have happened. So now we have to unravel the whole thing, like figure out like what was the starting point. And that's the beauty of Ayurveda. We have a system called pathophysiology or the samprapti of a disease. So we can find out exactly the origin of this problem in that particular individual by understanding their Prakriti and Vikruti. And using this fundamental philosophy of Ayurveda, we can really help the person to completely, unwind from all these complications that they have entangled themselves into. And when they are at that stage, their compliance is very good. Like they're ready. They're really looking for getting out of this. Whatever problems they have, and whatever we tell them, of course I try my best to give them a very simple suggestion to begin with, because I want to have their compliance, have them retained their interest in coming back for a follow-up, and keeping them kind of engaged. So I try not to barrage them with like 100 different things all at once, but I give them very simple little tips that are easy to follow. And as Dr. Tim said, I try to tell them, yes, I do it every day. I do these things, and I do a lot of workshops with them. So one of the challenges is like cooking, so a lot of people, oh, I don't have time, I can't cook this, I can't do this, it will take too much time. So I do small cooking workshops where right in front of their eyes they can see a delicious meal made for one person or two people within like 10 to 15 minutes, which is freshly made from local ingredients, from seasonal ingredients, and incorporating all the herbs, spices that are local to the US, that are palatable for American taste. And then we can, kind of adapt. It doesn't have to be like everybody has to rush to an Indian grocery store, or it doesn't have to be a culture shock. So that's the beauty of Ayurveda, that we can use the principles, we can use the philosophy and apply it to any culture, any country, any place on the earth, because the fundamentals are very strong about the mind, body, spirit, and how we can really apply them in a variety of diseases. So whether it is cancer, whether it is any degenerative diseases of neuromusculoskeletal nature, or digestive diseases, even psychosomatic, autism, depression, like we get so many people of all age groups that we can really very successfully clinically make a difference in their life, in their persona, in to really bring them back to their health, their homeostasis, or their prakriti. And one of the things I'm doing through a couple of organizations that I work for is we want to standardize a method of education. So like this medical school, the AWSOM, maybe we can have some more replicas, or some more those kind of medical schools opened here in maybe in Florida, maybe in some other states. And there is another very important branch of Ayurveda called Panchakarma. It's a therapeutic approach towards healing, cleansing, rejuvenating, and reestablishing the wellness. And that part really needs to be established and explored more into chronic ailments like maybe stroke, or even for obesity nowadays.
So
people
detox
want
the
to
body,
just
detox the mind. Well,
yes. So I think that also, once we get things more standardized, education, and more proper formatted as a medical system, then we should be able to do much more integrative approach in
absolutely.
variety of ailments.
So we're looking at standardized education, international collaboration, especially on clinical
Yes.
studies. We're talking about a structure for billing and revenue. We're talking about patient-centric medicine. We're looking at a person as a whole, mentally, physically, spiritually, not just the symptoms. We're looking at a whole person, and many times we forget that in conventional care. It has to be culturally sensitive and more inclusive. That is what I'm dreaming of, health in the US that is more inclusive, more patient-centric, better enhanced patient experience with more improved health outcomes. Because most of the chronic disease we're talking about, whether it's diabetes or cardiovascular disease or obesity, or even cancer, they are preventable. Early intervention is the key, and integrative medicine, that's where it fits in beautifully, because we could have prevented those diseases to go into stage 3, stage 4. Education, community awareness, and that's what this podcast is all about. And as I mentioned, Americans are spending a lot in wellness market. And yet we have a disproportionate burden of so many chronic diseases which could have been prevented.
Recently, the WHO and Ayush have come together to develop the
curriculum.
The codes, the codes, the ICD 9 code.
Ayush is the Ministry of Health in India, which is promoting all the holistic healthcare treatments. Ayush, AYUSH, it's Ayurveda, Yoga, Unani, Siddha, Naturopathy, and Homeopathy. So that is AYUSH. And what you're mentioning is Ministry of Ayush with World Health Organization has curated a curriculum for Ayurvedic medicine.
But also the diagnosis and the treatment, the ICD codes and the CPT codes, which are billable. Now we just have to integrate them with the insurance companies who will be ready to expand their services to alternative, healing.
Yeah. Wellness is not absence of disease. Wellness is when you're balanced, you're in homeostasis, and you are completely in tune with yourself and in tune with the circadian rhythm and in tune with nature. That is what it goes beyond just absence of disease. And that's what integrative medicine does. So I thank you all very much. Dr. Tim Fior practices family medicine and homeopathy in Chicagoland. Dr. Avinash Yadav from Florida, orthopedic surgeon. Vedaparna Bapat from Florida, Ayurvedic professional, and Eddie Stern, a very acclaimed yoga instructor. Thank you all for joining on this critical topic, and we hope that we've created some awareness and some little shift in the paradigm, make this picture a little bit more wholesome and organic. I'm Dr. Renee. Stay healthy, stay positive.